Good evening, dear friends. Welcome to my channel. Today we are going to discuss about the ligaments related to inguinal canal. This is a very short video which I am going to do now. Actually, in order to understand the inguinal canal, we need to understand how the ligaments are arranged in the body so that it will become very easy to understand the boundaries of inguinal canal. Let's get started. So before going to see the ligaments, you need to understand how the ligaments are attached to which bony prominences. So here I am showing the anterior superior iliac spine, and here you can identify the pubic tubercle, and this is called as pecten pubis, and this is the pubic symphysis, and this is the pubic arch. These are the frequently using points when you are discussing about the ligaments. So that's why I'm showing only these particular points. Another part is this is iliopubic eminence. Iliopubic eminence, and this is a pubic ramus, superior pubic ramus, and this is the inferior pubic ramus. So the first ligament which we are going to see is the external oblique aponeurosis part, which is going to form a thickening and forms a ligament called as inguinal ligament. So this is the external oblique abdominis aponeurosis. At the lower aspect of the external oblique abdominis, at the anterior to superior iliac spine to the pubic tubercle, we can identify the inguinal ligament. So here you can identify the inguinal ligament, which is extending from anterior superior iliac spine to the pubic tubercle. But how the ligament is extending and how the ligament is present, now we are going to see. So this is the inguinal ligament. A medial aspect of the inguinal ligament, you can identify the triangular shape opening apexis, which is projecting towards medially, and base is present here, and this is called a superficial inguinal ring. Now try to see the inguinal ligament here. So inguinal ligament, which is extending from anterior superior iliac spine to the pubic tubercle, and here this inguinal ligament is infolding. Let us see how it is infolding. So this is how it is infolding. So when you are seeing this, the curved bend, the curved part which is present here, the convex part which is projecting towards the thigh, then the canal-like part which is projecting towards the abdomen, and that is nothing but your inguinal ligament. Then after that, after infolding of the inguinal ligament, it is going to form a triangular shaped ligament. So the triangular shaped ligament, which is having the apex which is attaching to the pubic tubercle, and the base which is projecting towards laterally, and here it is related to the femoral ring. Here we can identify the femoral ring. Then this lacunar ligament, this is nothing but the lacunar ligament. It is having two sides, anterior wall and the posterior wall. Anterior part which is extending along with the inguinal ligament, and the posterior part which is extending from the pubic tubercle and is extending upwards, and it is reaching to the pecten pubis. So this is called as the posterior part. So from the posterior part of a lacunar ligament, the other ligament which is extending upwards and reaching to the iliopubic eminence, this is nothing but your pectineal ligament. Okay, simply remember, try to see the inguinal ligament, then infolding part of inguinal ligament, the triangular shaped ligament is called as lacunar ligament. So from the posterior part of the lacunar ligament, the other fibrous part ligament which is extending towards the iliopubic eminence is nothing but your pectineal ligament. Then other ligament which is a part, or which is a modification of this inguinal ligament, it is a part of inguinal ligament, is the reflected part of inguinal ligament, where it is formed. So after infolding of the inguinal ligament, some part which is extending lateral and forming the lacunar and pectineal ligament, another part which is extending upwards and medially, and which is running exactly in front of the conjoint tendon, that is nothing but your reflected part of inguinal ligament. Then conjoint tendon, here you can see just behind the reflected part of inguinal ligament, we can identify the arched fibers of internal oblique abdominis and the transverse abdominis. Those are forming the conjoint tendon, which is extending behind the reflected part of inguinal ligament, and they are reaching to the pecten pubis, pecten pubic tubercle and the pecten pubis. That is nothing but your conjoint tendon. So the relation of the conjoint tendon is, it is exactly present behind the pecten, behind the reflected part of inguinal ligament, and this reflected part of inguinal ligament which is attaching to the linea alba. That is about the ligaments of, yeah, here you can see the conjoint tendon. And don't miss to watch the next class, is very important, inguinal canal. already have understood the ligaments attachments, so that will become very easy to understand the inguinal canal and its contents. Thank you.